Every single year, millions of adults over 60 experience a fall. But here is the part most people never hear about. The majority of those falls do not happen while standing still. They happen while turning in a hallway, turning when someone calls your name, turning to look for traffic, turning to reach for something behind you. It is not simply your leg strength that keeps you upright. It is your ability to stay balanced while your head and body are moving. And today, we are going to uncover exactly how strong that ability is in your body. In this session, we will do two very important things. First, you will perform two quick balance tests designed specifically to measure how stable you are when turning and moving. These are not vague impressions. You will get real numbers, clear scores you can write down. Second, once we identify your starting point, I will show you 3 targeted exercises that directly improve the weaknesses these tests reveal. No gym, no complicated equipment, just a wall, a chair, and 5 minutes a day. Let's begin. Preparing your testing space safety first. Before we test anything, we must create a safe environment. Please do not skip this step. Find a clear, open area along a wall. This wall will act as your safety partner throughout the tests. Place a sturdy chair about 4 to 5 steps away from where you will stand. Make sure the chair will not slide. If needed, push it firmly against the wall. Now look down at the floor. Remove anything that could interfere with your footing. Loose rugs, slippers, cables, objects, anything uneven. Balance testing demands a clutter-free zone. If someone is at home with you, you may ask them to stand nearby, but these tests are designed so you can safely perform them on your own. All right, take a breath. Let's move to test number 1. Test 1. Tandem stance with head turns. This test reveals how well your balance system responds when your head moves, a key factor in preventing falls. Step-by-step setup. Stand next to the wall. Place one hand lightly on it for support. Now position your feet in a tandem stance, one foot directly in front of the other, heel touching toes, like standing on a tightrope. Take your time here. Feel your body settle. There is no rush. When you feel reasonably steady, gently release your hand from the wall, but keep it hovering just an inch away, close enough to grab instantly if needed. The movement. You will now begin slow head turns. Very slow. Turn your head to the right, return to center. Turn your head to the left, return to center. That completes one full cycle. Right gives center, gives left, gives center. Your job is simple. Count how many complete cycles you can perform before losing balance. Losing balance means grabbing the wall, moving your feet, feeling too unsteady to continue. Move slowly and smoothly. Do not snap your head. Think controlled, gentle, deliberate. Let's begin. Find your tandem stance. Release the wall when ready. Turn right, center, turn left, center. That is 1. Continue counting. Right, center, left, center. 2. Stay tall. Keep breathing. Right, center, left. 3. Move with control. Right, center, left, center. 4. And if you reach 5, excellent. Stop there. 5 is our maximum score. Record your number. Whatever your number is, remember it. This is your baseline. Shake out your legs. Take a few normal steps. Let your balance system reset completely before we continue. Because now we move from stillness to motion. Test to walk, turn, and return. This test measures your dynamic balance, how steady you remain while standing, walking, turning, and sitting. These are movements you perform dozens, even hundreds of times daily. Yet few people ever assess how safely they do them. Set up, sit down in your chair, hands resting on your knees. No stopwatch needed. We will simply count steps. When you're ready, stand up. Walk forward for 5 steps along the wall. Stop. Turn around carefully. Walk back 5 steps. Sit down slowly. Let's do it together. Hands on knees. Stand up. Walk forward. 1, 2, 3, 4, 5. Good. Stop. Now turn around slowly. No rushing. Take your time. Walk back. 1, 2, 3, 4, 5. Excellent. Turn and sit down with control. Slowly. Do not drop. Scoring your performance. Now, let's evaluate. Give yourself 1 point for each of the following you completed without difficulty. Standing up without pushing off with your hands. Turning around without wobbling or grabbing the wall. Sitting down slowly and under control. Maximum score, 3 points. Combine your results. You now have a score from test 10 to 5. A score from test to 0 to 3. Add them together. Your total score is out of 8. Example, test 1 gives 3 turns. Test 2 gives 2 points. Total gives 5 out of 8. Write your numbers down. Yes, actually, write them. These numbers matter. They are your starting line. What your score means. 7 to 8 out of 8. Your balance is functioning at an excellent level. Your vestibular system, coordination, and strength are working beautifully together. 4 to 6 out of 8. You have a good foundation, but there are clear weak spots. These are highly improvable. 1 to 3 out of 8. This is not failure, this is opportunity. Those with the lowest starting scores often see the most dramatic improvements because the balance system responds fast to proper training. And now that you know exactly where you stand, it is time to strengthen what your tests revealed. But before we begin the exercises, there is something important you must understand about why balance declines and why it can absolutely be rebuilt at any age. Before we begin the exercises, you need to understand something incredibly important. Balance does not disappear simply because of age. It declines because certain systems in your body stop being challenged. And the most overlooked of these systems is your vestibular system, the balance center inside your inner ear. This system acts like your internal gyroscope. It constantly tells your brain where your head is positioned, how fast you are moving, whether you are turning, tilting, or accelerating. When this communication is sharp, you feel steady. When it becomes sluggish, turning your head can suddenly feel like the world is shifting beneath you. That unsteady sensation, that momentary wobble, that brief dizziness, those are signals, not of aging, but of undertraining. And the good news, the vestibular system is highly adaptable. It can be retrained, strengthened, sharpened, even after 60, 70, or 80. Today's exercises are designed to do exactly that. Slowly, safely, effectively. Exercise 1 seated march with head turns. We begin seated for one reason: confidence and safety. When you feel secure, your brain learns faster. Correct position. Sit tall in a sturdy chair, not slouched, not leaning back. Imagine a string gently lifting the top of your head toward the ceiling. Feet flat on the floor, hip width apart, hands resting lightly on your thighs, core gently engaged, relaxed, but alert. Begin the march. Lift your right knee slightly, lower it. Lift your left knee, lower it. Continue alternating, a slow, steady rhythm, about 1 lift per second. no rushing, smooth movement. Add the head movement. Now comes the key challenge. While continuing to march, slowly turn your head to the right, as if calmly looking over your shoulder. Hold for 2 marching steps, then return to center. Continue marching. Now slowly turn your head to the left. Hold for 2 steps, return to center. That completes 1 cycle. Right, gives center, gives left, gives center. Perform 5 full cycles. Why this works? Your brain is now managing 2 tasks: coordinating leg movement, processing changing balance signals. This mirrors real life: walking while scanning a room, moving while checking surroundings. We are rebuilding that lost coordination. Common mistakes. Mistake 1: turning too fast. Fast head turns overwhelm the vestibular system. That is when dizziness appears. Think slow dial, not sudden spin, gentle, controlled. Mistake 2: holding your breath. Many people freeze their breathing when concentrating. But oxygen fuels brain processing. Keep breathing naturally. If you notice tension, exhale, relax, continue. Mistake 3: freezing the legs. If your march stops when your head turns, you lose the training benefit. Slow down if needed, but keep those legs moving. If dizziness appears, stop. The head turns. Continue marching with head forward. Wait until steady. Resume with a smaller range of motion. Adaptation happens gradually. Exercise 2: standing head turns, chair support. Now we add gravity. Your entire body joins the challenge. Starting position: stand behind a sturdy chair. Both hands resting lightly on the backrest. Feet shoulder width apart. Knees soft, never locked. Baton, shoulders relaxed. Horizontal head turns. Slowly turn head right. Pause 1 second. Return to center. Turn left. Pause. Return. Repeat 5 times each side. Only the head moves. Your body stays still. Vertical head movements. Now gently tilt head downward. Chin toward chest. Pause. Return. Then tilt slightly upward. Eyes toward ceiling. Pause. Return. 5 repetitions, each direction. Why vertical matters. Real world triggers. Looking up at shelves. Bending down. Reaching overhead. Untrained vertical motion often causes instability. We correct that here. Combine directions. Right gives center, gives up, gives center. Left gives center, gives down, gives center. 3 slow cycles, controlled, steady, progressions. When stable, 2 hands gives 1 hand, gives fingertips. Each reduction increases your body's balancing effort. Never rush progression. Common mistakes. Mistake 1: moving the whole body. Shoulders must not rotate. Chest must not lift. Isolate the head. Mistake 2: locked knees. Rigid legs destroy balance, responsiveness. Soft knees equals shock absorbers. Mistake 3: excessive upward tilt. Extreme extension may provoke dizziness. A gentle 30-degree tilt is enough. Comfortable, not strained. If vertical feels unstable, skip it for the first week. Master horizontal turns first, then add vertical. Exercise 3: tandem walk with head turns. This is the most functional drill because falls rarely occur while standing still. They happen while moving. Set up, stand beside a wall. 1 hand lightly touching it. Feet in tandem stance. Heel to toe. Movement pattern. Step forward. Next step gives turn head right. Next step gives return center. Next step gives turn left. Next gives center. Continue for 8 to 10 steps. Stop. Turn carefully. Walk back what you may feel. Wobbling, foot corrections, instability, all normal. This is your brain recalibrating. Common mistakes. Mistake 1. Looking down. Looking down disrupts vestibular training. Eyes forward. Trust your feet. Mistake 2. Rushing. Speed increases momentum. Momentum increases falls. Slow is safe. Slow is effective. Mistake 3. Turning body with head. Head rotates independently. Shoulders stay forward. Hips stay forward. If too difficult, week 1 gives tandem walk only. Week 2 gives add head turns. Gradual progression produces lasting stability. Your 5-minute daily plan. Seated march with head turns to 1 minute. Standing head turns 2 minutes. Tandem walk with head turns 2 minutes. Total 5 minutes. Daily consistency beats occasional intensity. And here is what typically happens. Within days, gives movements feel smoother. Within a week, gives less wobbling. Within 2 weeks, gives noticeable confidence. Because your brain is learning again, strengthening its balance circuits. But there is one final piece that determines whether your improvement is temporary or lasting. A simple strategy most people ignore. There is one critical truth about balance improvement that most people never realize. Exercises alone are not enough. If you train for 5 minutes, then spend the rest of the day moving cautiously, stiffly, or avoiding head turns, your brain receives mixed signals. Training says, we are safe to move. Daily habits say, movement is dangerous. And the brain always listens to repetition. That is why lasting improvement requires something simple yet powerful. Integration into daily life. You must teach your brain that balance is not just an exercise activity, it is a living skill, woven into normal movement. The golden rule of vestibular progress. Small challenges, repeated often, performed safely, not extreme effort, not exhaustion, but gentle, consistent stimulation. Micro-training moments, your secret weapon. These are tiny opportunities scattered throughout your day. They require no extra time, only awareness. First, head turns during walking. While walking down a hallway, take 2 normal steps, looking forward. Then gently turn your head right for 1 step. Return to center, then left. Keep walking, calm, controlled. This transforms ordinary walking into balance training. Second, controlled turns. Whenever you turn around, do not pivot quickly. Slow the movement. Feel your feet. Feel the weight shift. Let your brain register the motion. Fast turns create instability. Slow turns create neurological precision. Third, look up and down practice. While standing safely near support, glance up at a shelf, return to center. Glance down at the floor, return. You are training vertical stability without a formal session. Fourth, sit to stand awareness. Each time you rise from a chair, stand smoothly. No sudden push, no jerking. Each controlled transition reinforces balance pathways. Why this integration matters. Your brain learns balance through context, not isolated drills. The more environments you safely challenge it in, walking, turning, reaching, changing direction, the more resilient your stability becomes. What to expect over 14 days? Let's set realistic, encouraging expectations. Days 1 to 3. You may feel slight wobbling, mild awkwardness, increased awareness of imbalance. This is normal recalibration. Your brain is being asked to update old patterns. Days 4 to 7. Movements begin to feel smoother, more predictable, less mentally demanding. Confidence quietly begins returning. Days 8 to 14. Noticeable changes often include easier turning, reduced grabbing for support, greater walking stability, less fear of sudden movement, and sometimes the most meaningful improvement, mental confidence. Because fear of falling can be as limiting as instability itself. Important safety reminders. Always respect your body's signals. Stop immediately if you experience strong dizziness, spinning sensation, nausea, or sharp pain. Mild challenge is good. Overwhelm is not. Use walls, chairs, and supports without hesitation. Safety accelerates progress. Risk delays it. Now, your commitment. You started today with real numbers. Your personal balance snapshot. Now imagine this. 14 days from now, you repeat the tests. Your stance feels steadier, your turns smoother, your score higher, not because of luck, but because of 5 minutes a day. Write your starting numbers down. Place them somewhere visible, refrigerator, mirror, notebook, because what gets measured gets improved. And remember this deeply. Wobbling during training is not weakness. It is your nervous system learning, adjusting, growing stronger. You are not losing balance with age. You are simply retraining a skill that has been underused. And skills can always be rebuilt at any age.